Discussing electrophysiology services and the device clinic is nurse practitioner Erin Gillen. Please explain what you do here at the Heart Center.
I am a nurse practitioner at the Heart Center. More specifically, my specialty is electrophysiology. So I am part of the electrophysiology service, and I also manage the device clinic.
What is electrophysiology?
Electrophysiology is the study of heart rhythm. Basically, within the heart is an electrical system that is responsible for sending electrical impulses from the top of the heart to the bottom of the heart, which produces a heartbeat. These impulses are innervated by different parts of our body. You know, there's hormones that tell the heart when the heart rate needs to increase with exercise and things like that. Often there are perversions that can occur with electrical impulses and with the electrical system. And electrophysiology is basically the study of normal and abnormal heart rhythms.
Please tell us about the devices that are used in the device clinic.
In electrophysiology, most of the work that we do that enables us to essentially cure a lot of electrical problems involves implantation of a device of some sort. The devices include things like pacemakers, defibrillators, and loop recorders. In short, basically a pacemaker is an implanted device that is responsible for treating slow heartbeats. Within the heart, there's an intrinsic electrical system, and what's basically supposed to happen is that your heart is supposed to tell, this SA node up here is supposed to tell your heart how many times a minute to beat. When it sends out the electrical impulse, it's supposed to be conducted here, and then this gets conducted down to the ventricles, causing the heart to beat. So when people have perversions of their conduction system, sometimes this SA node doesn't kick out enough beats. Sometimes there's a disconnect between the top and the bottom. So your heart may know how many beats a minute that you need, but the bottom part of the heart, which is responsible for squeezing and producing your pulse, is not receiving any or all of the impulses. When we implant a pacemaker, we put an artificial wire. One would be in the top part of your heart and one would be in the bottom part of your heart, and that would provide you with an artificial connection between the top and the bottom part of your heart so that you would have restoration of a normal heartbeat.
Can you show us what a pacemaker looks like and how it works?
People often ask me what a pacemaker actually looks like. Often by the time I see them in the office, the pacemaker is already implanted in them, so they don't get to see it. A pacemaker is actually pretty small. It's typically implanted under the skin in the left pectoral area, which is right here. The pacemaker is then connected to wires. The wires are snaked through the vasculature to the heart muscle. So there's a sensor on the end of this wire that's in the bottom of your heart, and then it gets plugged into the pacemaker so that if your heart's not beating fast enough, the pacemaker will notice that you need a beat, it will stimulate your heart to beat, and then you'll have a normal pulse rate. And of course, the energy is generated from this pacemaker.
Please tell us what a loop recorder is and what it does.
A loop recorder is actually quite interesting. It's a little machine that gets inserted right in the middle of your chest. And basically what it does is it records heartbeats probably over like a 1.5 year period. So there are often people that have intermittent heart rhythm problems. So people have palpitations at home that are bothersome. They have fainting spells, and we're unable to really determine what's happening. Often in the office we'll do a monitor for 24 hours. Sometimes we'll do a monitor for a month, and those don't show anything. So the next step would be to implant this loop recorder. And like I said, it goes underneath your skin. There are no wires to your heart, but this enables us to query the loop recorder when you come into the office every 3 months. So if a patient has any symptoms, we can justify the symptoms to any abnormality that may be recorded on the loop recorder.
What is a defibrillator and how does it work?
So an automatic implanted defibrillator is another type of device that we implant in patients. The reason for the implantation of a defibrillator is actually quite different than the reason for an implantation of a pacemaker. There are subsets of patients that are identified to be at risk of dying suddenly. I think at the current time the statistics are that 300,000 people die per year in the United States suddenly, and some of them are likely from cardiac arrest. This implanted defibrillator can detect if you're having fast heartbeats that can be life-threatening and deliver energy to your heart to get you out of that situation. So the defibrillator actually delivers a shock, which is a life-saving therapy, and enables people to live a normal life and hopefully get to the hospital and get the treatment that they need if that's necessary. It's only about this big. You may see on television that people get defibrillated on ER and they have to use these great big paddles. This actually accomplishes the same thing, but since it's within your heart, it can be a lot smaller, but provide the same therapy and a lot quicker with a lot better success.
Can I get a shock from a defibrillator?
So as we discussed, defibrillators are implanted to be life-saving machines. And if someone has a life-threatening arrhythmia, often it needs to be terminated with a shock. So patients, of course, always ask me, what do I do if I get a shock? Typically, if someone gets one shock and they feel okay, so you got a shock, you feel you're not short of breath, you don't have any chest pain, your spouse says that your color looks good, nothing else is wrong, usually I say to call me in the office and we'll talk about whether or not you need to come to the office that day, use one of those machines that you may have, or come the following day. If somebody, however, gets a shock and they don't feel well in any way, so they can't breathe, they have chest pain, they're dizzy, your wife says you look terrible, then you go directly to the hospital. And if someone gets more than one shock, I ask them to go directly to the hospital.